The pituitary gland, often referred to as the master gland, plays a central role in regulating the endocrine system. This lecture will explore the anatomy of the pituitary gland, its distinct lobes, and the significance of its vascular and neural connections, highlighting its crucial role in orchestrating the body's hormonal symphony. Anatomical location and structure. Location. The pituitary gland is nestled within the sella turcica, a saddle-shaped depression in the sphenoid bone of the skull. It is directly connected to the hypothalamus via the pituitary stalk, infundibulum, allowing for seamless communication between these two crucial structures. Lobes of the pituitary gland. The pituitary gland consists of two main lobes with distinct embryological origins and functions. Anterior pituitary, adenohypophysis, comprises glandular tissue and produces a variety of hormones that regulate growth, metabolism, reproduction, and stress response. It is further divided into the pars distalis, pars tuberalis, and pars intermedia. Posterior pituitary, neurohypophysis, consists of neural tissue and serves as an extension of the hypothalamus. It stores and releases hormones synthesized in the hypothalamus, playing a vital role in water balance and uterine contractions. The posterior pituitary is composed of the pars nervosa and the infundibular stalk. Hormones of the pituitary gland. Anterior pituitary hormones. Growth hormone. Stimulates growth and cell reproduction. Prolactin. Promotes lactation in breastfeeding women. Adrenocorticotropic hormone. Stimulates cortisol production by the adrenal glands. Thyroid stimulating hormone. Stimulates thyroid hormone production by the thyroid gland. Luteinizing hormone. Triggers ovulation and stimulates testosterone production. Follicle stimulating hormone. Promotes the development of ovarian follicles and sperm production. Posterior pituitary hormones. Oxytocin. Stimulates uterine contractions during childbirth and milk ejection during breastfeeding. Antidiuretic hormone, ADH, vasopressin, promotes water reabsorption in the kidneys and constricts blood vessels to regulate blood pressure. Regulation and neural connections. Anterior pituitary regulation. The anterior pituitary is under the control of the hypothalamus, which releases both releasing and inhibiting hormones. These hypothalamic hormones travel through the hypophyseal portal system, a specialized network of blood vessels that directly connects the hypothalamus and anterior pituitary. Posterior pituitary neural connections. The posterior pituitary is directly connected to the hypothalamus through the hypothalamic hypophyseal tract, a bundle of nerve fibers that transport oxytocin and ADH from their production sites in the hypothalamus to the posterior pituitary for storage and release. Vascular supply. Anterior pituitary receives blood supply from the superior hypophyseal arteries, which form the primary capillary plexus. This network connects to the secondary capillary plexus in the anterior pituitary through the hypophyseal portal veins, facilitating the transport of hypothalamic hormones. Posterior pituitary, primarily supplied by the inferior hypophyseal arteries, which form a capillary network around the posterior lobe, allowing for efficient hormone release into the bloodstream. Clinical significance. Dysfunction of the pituitary gland can lead to various disorders, including pituitary adenomas, benign tumors that can affect hormone production, leading to conditions like Cushing's disease, excess ACTH, or acromegaly, XSGH, hypopituitarism, insufficient hormone production due to pituitary damage, resulting in various deficiencies, diabetes insipidus, deficiency of ADH, leading to excessive urination and thirst. Diagnostic imaging. Magnetic resonance imaging, MRI, is the gold standard for visualizing the pituitary gland and identifying any structural abnormalities. By understanding the intricate anatomy of the pituitary gland, you gain a deeper appreciation for its pivotal role in maintaining hormonal balance and overall physiological homeostasis.